Hello everyone, my name is Sean,
My name is Leona.
and today we are discussing when does the anxiety become a problem. So, as you can see from the first slide, and then we our presentation is based on the one of the New York Times news. So it is when does the anxiety become a problem? Leona, and the first question in that article really struck me with what are normal level of anxiety? How much is too much? And I think that confusion is the biggest barrier for people seeking help.
Absolutely. The article makes it clear it's normal to feel your heart race before a big test, but it comes as a signal to seek treatment if the worry and fear are constantly there, or if it starts affecting your work, sleep, and relationships. That shift from temporary stress to pervasive disruption is the key.
Right, and often, and like you say, people try to avoid triggers, which means the article notes and can actually make the anxiety worse. And they don't realize those physical symptoms, which means the racing heart, the trouble sleeping, are tied to a treatable condition.
Yeah, that's why the new U.S. Preventive Service Task Force recommendation is so vital, requiring doctors to screen all adults under 65 shifts the burden. You don't have to self-identify as having a problem anymore. Your doctor just asks you the questions.
Yes, you're right, and it takes the stigma out of initial sleep, initial step. But then the patient asked, "What is the treatment like?" The article highlights two main paths. What are the key differences?
The two established paths are psychotherapy and medication. Psychotherapy, particularly cognitive behavioral therapy, we call CBT, is highlighted as the most effective. It's not about just curing anxiety, but teaching people new ways of thinking, reacting, and behaving to manage their symptoms long term.
Yes, and as you mentioned, the CBT is really important. So basically, CBT gives you the tools to manage yourself, and you can see the slide. And so, Leona, and what are the medications?
Medications, usually short-term anti-anxiety drugs or antidepressants, don't cure anxiety, but they can provide significant relief from symptoms. Um, they essentially help lower the baseline of distress so that the patient can more effectively engage in therapy like CBT. The article makes a point of saying they can be used alone or in combination.
Yes, and yeah, like CBT is very important and vital. And the fact that the treatment, whether it's CBT medication or both, is available and works, is the most important message. And the new screening, as long as doctors follow through with appropriate diagnosis and referral, should connect a lot of people to that help earlier, right?
Yeah, precisely. Early detection and intervention are crucial. The article warns that without follow up, screening is potentially harmful. So, the goal is not just to check a box, but to ensure that everyone identified gets connected to the evidence based care that can stop anxiety from costing them years of a fulfilling life.
Yeah, and 100% true, and absolutely. So I think the diagnosis isn't the finish line, right? it's just the starting gun for the effective treatment. So based on our discussion, so this is our findings about the news.